Samarth and working as a senior consultant in Davangere. I have been in this field for almost 7 to 8 years now, and I'm also working as a professor in JJN Medical College, Davangere. See, today I just wanted to talk and highlight regarding a topic known as hypertension, which is common prevailing in India, and it has become a global disease. So let's talk about hypertension today. Generally, everyone would like to have healthy or normal blood pressure, but what exactly does hypertension mean? First, we should know what is the definition of blood pressure. Each time a heart pumps its blood or contracts, there is a pressure which is generated against the walls of the arteries. That is called as blood pressure. Normally, in healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can become because of his unhealthy lifestyle, or it can become because of the stress, or because of the lack of physical activity, obesity, smoking. These all contribute for your high blood pressure. There are other risk factors also which can contribute for the high blood pressure. One is age. As person gets older or the age increases, there will be general arteriosclerosis of the blood vessels. So that can also lead to the increase in blood pressure. And second thing is family history of blood pressure. If someone in the family members are having a blood pressure, like your first grade relatives, like any father or mother, then the chances of increasing blood pressure is more. And excess salt intake in the diet. Not having enough appetite, food habits like lack of vegetables and fruits in the diet, and eating lot of processed food. And another one is stress. Moving on to the signs and symptoms of hypertension. Usually, the patient doesn't have any symptom of hypertension as such. But as I see in my clinical practice, the patient will complain of vague symptoms like headache, body ache, or the patient can have neck muscle pain. So we generally refer this hypertension as a silent killer. Hence, early and accurate diagnosis is a very much and keen essential for the treatment, and for also to prevent the prognostic markers for this hypertension. So this, what will happen is, this hypertension will also cause other diseases, like it can affect your eyes, it can affect your kidneys and other organs also. So in order to prevent that, we need to have early and good control of the hypertension. Okay. Normally, a healthy normal blood pressure should be lower than 120 by 80 mm of Hg, or it can also read as much as till 140 by 80 mm of Hg will be considered as normal. This, if the patient blood pressure is more than 140, when we label him as hypertensive. There are many preventive measures in order to prevent for hypertension. One is regular exercise. What we advise is a regular exercise of nearly 30 minutes per day, whether it could be aerobic exercises or it can be other exercises also, can result or prevent from hypertension. Second is healthy diet. In healthy diet, first includes DASH diet. DASH stands for dietary approaches to stop hypertension. That includes more of fruits, vegetables, and low diet fat and saturated food and cholesterol can lower blood pressure by up to 11 mm of Hg. And third is reduce sodium in your diet. Even a small reduction of sodium in diet can improve the heart health and reduce blood pressure by almost 5 to 6 mm of Hg. If you have high blood pressure, to decrease sodium in your diet, you can consider tips like read food labels. If possible, choose low sodium alternatives, eat fewer processed foods, and don't add salt in your diet. Just one level of teaspoons of salt has 2,300 micrograms of sodium. Avoid adding salt to food. Use of herbs, spices to add flavor to your food. And fourth is quit smoking. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve overall health.